we're gonna do Ryan's upper trapezius muscle right here. I've got a 40 millimeter length needle and an alcohol swab. So we're just gonna disinfect the area. And I get a pretty good area just because I'm in a POW point for a good trigger point. A trigger point, all it is just wound up muscle tissue. Muscle tissue lays parallel, nice and uniform. When you get a trigger point, when a muscle is overworking to compensate, usually for a joint, what happens is those muscle fibers don't lay down parallel, they knot up. And so when we palpate, we can find a pretty dense trigger point. Actually, right there's a pretty good one. Do you see it just roll? So what we do with the needle is I'll take it and I'm gonna piston that area to make sure I hit that trigger point. I go in 4 different directions, northeast, south, and west. It takes about 20 seconds per needle, but it's just to ensure that we hit that trigger point. When we do get it to release, you might see some twitches. He might have some referred pain up or down the chain. When we hit that trigger point, it releases bradykinin, substance P, and CGRP into the bloodstream. And the only way to flush that out is through hydration and sweating, so urinating and sweating. All right, Ryan, are you ready? Try to grab that again. It just ran from me. There we go. All right, so you'll feel a little stick, Ryan. So we just drop the needle in through the skin, and we're gonna drive it down, and you might see a little twitch. You see that twitch? Ooh, there it was. All right, and then we just go 4 different directions. When we do this, we make sure we're superior to the first rib. That way we're not in the lung field. And a little bit. Yeah, those are good twitches. And then he gets a little TLC at the end. How was it?
Good.
Good. And then now if you were to actually feel this, it's flattened out quite a bit. So it's still got a little bit of a trigger point in there, but I would hit that again with another one.